Good afternoon. My name is Hana Horak, and I have made this presentation and research within the area of cross-border healthcare services with my colleague, Professor Nada Bolero-Gavukova. Unfortunately, she couldn't come because of illness, but I hope I will replace her well. I would like to thank organizers which have invited us to speak at this conference. I'm a professor of commercial law and European market law, and Nanda is professor of European public law. So we are delighted that we are among the civil procedure experts. Our research has brought up some questions, and I would like to open up them today here between all of you, and maybe to encourage you and to give you some ideas to research more and further in this field of healthcare services. As you all know, Croatia is approaching and it is at the doorsteps of the European Union, and of course the complete regulatory framework has been harmonized in a due time. Within of these processes of harmonization, I would say enormous number of regulations, directives have been implemented. And of course, new number directives at the European level are expecting to be implemented within the Croatian law. The enormous work has been done, but of course, within the national regulatory framework, still there are some, I would say, space for improvement, for better enforcement, and of course for better, what is the most important, implementation. When we speak about the healthcare services, as far as we see this issue and this problem, healthcare has enormous national political significance, and healthcare services are in the primary competence of the member states of the European Union. Health services form a part of the freedom to provide services, as it is confirmed by the European Court of Justice in a number of cases. Due to their special character, health services and character, they of course differ from other types of services. Focus is of course on the citizens and social benefits at national level. Free cross-border provisions of healthcare services includes the rights of patients to receive health services abroad. The most important is, of course, to receive healthcare abroad under the same conditions applicable in their home country. Bearing in mind the previous I have said, of course, we see that in Croatia there will arise a lot of problems. Influence of the freedom to provide services in the area of healthcare services also affect other freedoms, and of course different specific areas such as freedom of movement of workers and members of their families. Social rights, of course, in the connection with workers' demand for healthcare benefits from other member states. Importance of the coordination of laws through different procedures have been foreseen, of course, such as open methods of coordination. We have seen that internationalization, globalization, and free flow of capital, free flow of workers' mobility, and entrepreneurship have raised new issues regarding healthcare services. First issue or first question, I would say, is a question of boundaries to which healthcare insurers are ready to open to the market, reimbursement of the cost for the services received in another member state, and the second question, I would say, is of physicians' freedom to provide services, free movement of pharmaceuticals and medical technical appliances, cross-border competition of private providers of healthcare insurance. We find two different issues here. First is the principle of individual cross-border choice inherent in European free rights versus principle of solidarity that defines national healthcare systems in European countries. Usually the conflict is regulated by the regulation 1408 through 71 and regulation 883 to 2004. Of course, these coordination rules do not aim to harmonize national rules in the area of social security, and the EU coordination doesn't mean replacing the body of national rules with European rules. Interpretation of these two regulations I have mentioned is a trigger of many battles between the European Court of Justice and expanding cross-border rights and member states seeking to protect national powers in the area of social security policies. Of course, rules of receiving cross-border health services and reimbursement of the costs are not always clear or easy. And development has been achieved through the last, I would say, 10 or 12 years through the European Court of Justice case law. In the field of services, there is Directive 2006 through 123, which should provide safe, high quality and efficient cross-border healthcare, but newly adopted Directive 2011 through 24 is directive which regulates the application of patients' rights in cross-border healthcare. I should mention, of course, that there is a specific framework for healthcare services, especially for cross-border healthcare services. It is issue of the entitlement of patients to have healthcare in another member states, including the limits that member states can place on such healthcare abroad, and the level of the financial coverage that is provided for cross-border healthcare, which is of course based on the principle that patients are entitled to obtain reimbursement up to the amount that would have been paid if they had obtained the treatment at home. So I would say that this issue has been developed, of course, in favor of the internal market. Within the European Court of Justice case law, the right to reimbursement of the cost of healthcare provided in another member state from the statutory social security scheme of patients has been recognized in several judgments. I will now only mention those judgments, and in our paper we will discuss it extensively. These judgments are called Decker, Van Brekel, Smits and Verboms, Miller, Forêt and Van Riet, Watts, and I would say the new ones, or I would say the one which confirmed the previous case law is case Elcino. Through this case law, the European Court of Justice has ruled that the freedom to provide services includes the freedom for the recipient of services, including persons in need of medical treatment, to go to the other member states in order to receive those services there. I would say that the European Court of Justice has established the basic principle, so healthcare services are within the scope of the Article 56 of the Treaty on Functioning of the European Union, and Article 56 of Treaty covers the freedom to provide services and freedom to receive services, of course. There is a difference within the case law of reimbursement of the cost for non-hospital care and hospital care, but in the new directive 2011 through 24, those issues have been regulated in a different manner. The most important issue which directive has been regulated is of course, reimbursement of the cost of healthcare provided in the other member state in order to facilitate the right to provide and obtain healthcare services. Directive aims to establish rules for facilitating access to safe and high-quality cross-border healthcare in the European Union and to ensure patient mobility, of course in accordance with the principles established by the European Court of Justice. I would like to mention that there is a definition what is member state of affiliation and what is a member state of treatment, and that is, I would say, a new improvement from the previous proposals of directive. So member states of affiliation means that for insured persons, including members of their families, the member state that is competent to grant to the insured person a prior authorization to receive appropriate treatment outside the member state of residence. And the definition of the member states of treatment is the member states on whose territory healthcare is actually provided to the patient. In the case of telemedicine, healthcare is considered to be provided in the member state where the healthcare provider is established. Of course, the problem is that the member state of affiliation may choose to limit the reimbursement of cross-border healthcare for reasons relating to the quality and safety of the healthcare provided, and where this can be justified by already reasons of general interest relating to public health. The member states of affiliation may also take further measures on other grounds where this can be justified by such already reasons of general interest. What should be borne in mind? The transposition of directive into national legislation and its application should not result in patients being encouraged to receive treatment outside their member state of affiliation. We of course see a huge problem in Croatian healthcare sector because we have a great issue of a long waiting list. So application of these directives in a national law would, I would say, raise a great number of problems because during the implementation we should pay attention of, I would say, positive and negative lists. So, of justification, which treatments should be justified according to this directive. Nada has pointed out few procedural restrictions, so healthcare as the responsibility of member states is of course challenged to prior authorization rules. So opportunity of entry and exit to their healthcare system, open to providers and patients. And European Court of Justice, through the case law, I would say through the practice, undermine national means to use procedural rules by placing national healthcare under the Article 56, providing the free movement for services. And of course, there is a problem of different means of founding healthcare systems in the European Union. So one system of social insurance type and other system which is based on tax-funded model. For the purpose of reimbursing the cost of cross-border healthcare, directive should cover not only the situation where the patient is provided with healthcare in the member states other than member state of affiliation, but also the issue of prescription, dispensation and provision of medicinal products and medical devices where these are provided in the context of health service. The definition of cross-border healthcare should cover both the situation in which a patient purchases such medicinal products and medical devices in the member states other than the member states of affiliation, and the situation in which the patient purchase such medicinal products and medical devices in another member state than that in which the prescription was issued. When a patient receives cross-border healthcare, it is essential for the patient to know in advance which rules will be applicable. The rules applicable to cross-border healthcare should be those set out in the legislation of the member state of the treatment. Given that in accordance with Article 168 of Treaty on Functioning of the European Union, the organization and delivery of health services and medical care is the responsibility of the member states. This should help the patient in making an informed choice and should avoid misapprehensive and misunderstanding when choosing the healthcare services. It should also establish a high level of trust between the patient and the healthcare provider. Instead of conclusion, I would say that Europeanization of healthcare services have improved patients' rights on a supranational level, but on the other hand, we can foresee the loss of the national boundaries of the national healthcare system. We can also see a lot of rising practical problems still remains in national healthcare administration system, such as justifiability of social rights and, of course, issue of pre-approval of treatment. So, issue of healthcare choice framed by economic, not social objectives, despite the fact that all EU healthcare systems are defined by the social objectives, we cannot see at the moment as in favor of patients' rights on the national level. So thank you very much for your attention.